and micronutrients and soil and microplastics and all sorts of topics that we know are central to the health of kids. Screen time. Well, we're doing our part at the FDA. And I'm just going to run through a quick list of what we've done. I've been there 5 months, but we are doing everything we can to contribute to the MAHA agenda. On the food side, we've worked closely with USDA. We took the action on petroleum-based food dyes, approved natural dyes, 4 already this year. Typically, the FDA would approve 1 or 2 every several years. We approved 4 in the last 5 months. Took action on the GRAS standard, changed the BRICS requirement for sugar with orange juice, allowing more American oranges to be used for orange juice instead of importing oranges as frequently as was required by this arcane regulation. Initiated a chemical review. We're working with USDA to change the broken food pyramid, maybe one of the greatest sources of misinformation in modern American history. We're ending the 50-year war on natural saturated fat. Remarkably, schools, by regulation, are not supposed to have a certain amount of whole milk. That makes no sense scientifically. It's been a nutrition guidance by the government based not on evidence, but on dogma. And so we're challenging medical dogma, challenging dogma on infant formula. Another one of our big goals is to deliver more cures and meaningful treatments to the American public. And so we have taken action to reduce animal testing, to speed up the time for approvals in synchronization with EPA, also taking action to reduce animal testing. It's the right thing to do. We began a national priority review pilot. We're going to get decisions out in weeks instead of nearly a year. We're going to see amazing, meaningful treatments, I believe, in the next year and 2 years that are going to blow people away because of this new pilot program. We started a pre-check program to promote the domestic manufacturing of medications as a national security issue. We're ending conflicts of interest on expert panels. We are setting clear, transparent vaccine regulation for the COVID vaccine. We're using gold standard science and common sense. We've removed regulation for gene therapy, had an amazing roundtable on cell and gene therapy. Last week, we made all of our rejection letters public. If we don't accept a drug, the public deserves to know why. So for the first time in history, those letters are public, so the public can see it and keep us accountable. We are focused on rare diseases and incorporating AI. We are making adverse events disclosed on a daily, real-time basis. And we took action on concentrated fluoride for babies that is affecting the microbiome. And we're just getting started. We're also very focused on the opioid addiction crisis. It's not over just because there's other news. We have draft guidance for non-opioid pain medication that is going out tomorrow. We've taken action on 7-OH and opioid in most vape stores in America. We're calling it out, initiating the scheduling at DEA. We are talking about vape stores, trying to educate parents. We have now issued a number of statements on gas station heroin, and we are finally changing the label on OxyContin, which is long overdue. So with that, I just want to say thank you for the privilege of being a part of this incredible commission. I think this is an incredible day for the medical community in the United States, so thank you.
Thank you, Marty. We'll now hear from Jim O'Neill, who is the deputy at the HHS.
Thank you. All Americans deserve to be healthy, and we're going to get there. And this commission and this team of agencies is going to help us achieve the